Hey y'all, welcome back to the QBAC remediation. This is going to be the remediation for week 10. And so I have another set of 3 questions that I wanted to talk about. The first question is a prioritization question again. So the nurse in the emergency department assesses multiple clients involved in a bomb explosion. Following principles of mass casualty, which client does the nurse attend to first? So there were 4 options that were given. Let me go through them. Option number 1 states a client with an absent pulse and absent respirations. Option number 2 states a client with a penetrating trauma to the eye. Option number 3 states a client with carbonaceous sputum and wheezing. And option number 4, which is a client with an open fracture of the femur. So I picked answer choice number 1, but this is incorrect because this client does not show any signs of life because they have an absent pulse and absent respirations, and so they should receive the lowest priority in a mass casualty situation. The person that should receive the highest priority was answer choice number 3, a client with carbonaceous sputum and wheezing. This is correct because this client is the most unstable. Carbonaceous sputum, or sputum that has been burned, usually appears frothy with burned particles in it. Carbonaceous sputum and wheezing suggest smoke inhalation injury caused by considerable irritation to the bronchial tree. Smoke inhalation injury carries a high risk of death due to the significantly increased incidence of respiratory failure and acute respiratory distress syndrome, or ARDS. And so that's why answer choice number 3, which has to do with airway and breathing, is correct. The next question that I want to talk about is another prioritization question. The question reads, the home care nurse receives a phone call from the caregiver for a client diagnosed with AIDS. The caregiver reports having the flu and is afraid of giving the client an infection. Which action does the nurse take first? And so the answer choice that I picked was answer choice number 2. Assess whether the caregiver is washing hands frequently before providing care. Now, this is an appropriate action, but however, the nurse should first assess for the availability of another caregiver. There's no other caregiver, there's no one washing their hands. And so the correct answer was answer choice number 3, which is to determine if there is someone else available to provide care for the client. Now, this is the priority because the priority is to prevent the client's exposure to infection. The nurse should first determine whether another healthy caregiver can provide care in place of the caregiver with the flu. This will protect the client from exposure to the flu. And that's why answer choice number 3 is correct. The last question that I want to talk about is a select all that apply question. The question reads, the nurse performs a 6-minute walk test on a client diagnosed with COPD to determine the need for long-term oxygen therapy. During ambulation, the client's oxygen saturation is measured at 88%. Oxygen of 2 liters via nasal cannula is placed on the client. The SpO2 now measures 95%. Which action will the nurse perform? This is select all that apply. So there were 2 correct answer choices, and I happened to only pick one of them. The answer choices are listed as follows. Number 1, remove the oxygen via nasal cannula and notify the healthcare provider. Number 2, document the walk test and oxygen saturations. Number 3 was increase oxygen level to 4 liters via nasal cannula. Number 4 was advocate for a physical therapy consultation to work with the client's ambulation. Answer choice number 5 is to advocate for a case management consultation to initiate long-term oxygen therapy. So I got answer choice number 2, document the walk test and oxygen saturations, but I did not also click option number 5, which is to advocate for a case management consultation to initiate long-term oxygen therapy. Now, answer choice number 2 is correct because any tests and interventions performed by the nurse must be documented in the medical record. This information is used by case management to fill out a certificate of medical necessity for oxygen therapy. Answer choice number 5, which I did not pick, is also correct because long-term oxygen therapy improves quality of life for COPD patients, at least in part to the time spent using supplemental oxygen. Case management workers fill out a CMS form to request long-term home oxygen therapy. And so that's why answer choices 2 and 5 are both correct and not just 2. And with that, we have the 3 questions I wanted to talk about this week. I hope you guys have a great day. Thank you.